This is Perspectivas Latinas, a community service of CAN TV. I'm your host, Juan Carlos Hernandez. For nearly 40 years, Community Health Partnership of Illinois has offered Latino migrant workers and others an array of healthcare services. Our guests today are here to talk about the rewards and challenges of their work. Welcome.
Thank you so much, Juan Carlos.
Let's start off by talking about you and your role in the organization. Let's start with Susan, please.
Sure, thank you so much. First of all, we want to thank you for your interest in our organization. We have a lot of pride in the work that we do and a lot of caring for the communities that we serve. So this is really a privilege for us to be here today.
You're welcome. Thanks for being here. I feel privileged.
That's very nice of you to say. I'm currently the Executive Director of Community Health Partnership of Illinois. I've been with the organization now for almost 35 years. My anniversary is coming up in June. So I originally was a health educator at one of our clinics in Rochelle, Illinois, and then over the years took on other roles and responsibilities, doing a lot of grant writing, program development, and that sort of thing. So for the last decade, I've been the executive director of this organization.
Wow. You've been 35 years. Wow. It's a rarity now to be somewhere that long.
I know it is kind of startling when I look up and say, how did that happen? But it's good work, it's important work, and I have the privilege of working with an amazing group of people who have dedicated themselves to this work as well.
That's great to hear. Monserrat, tell us about yourself and what you do with the organization, please.
Okay, so my name is Monserrat, and I have like two roles. I am the revenue cycle manager, and I also run the Promotores program. So about the Promotores program is a group of health educators. So we meet once a week, and then we talk about a health topic. So then they go to the houses to talk about this topic to avoid illnesses. So there is a very nice communication between like the people, the patients and the clinic. So they are like a bridge that they can communicate, and I just love this program because the community really trusts them. So it's an amazing program and I love it. And I have been working in this program for 8 years.
8 years. That's a rarity too.
And she's one of the newer staff people that we have.
Really?
Yes.
Wow. The people stay with you then.
Oh, yes.
Actually, there's others that have more tenure with the program than I do. So I'm not the oldest kid on the block.
Joel, tell us about yourself and what you do with your organization.
Okay, well, I'm the newest, probably the newest in the organization. I have been there for about 6 months.
6 months?
About 6.5 months. I started the last of July of last year, and you know, I applied for the job. I never thought I would get it, but they gave it to me. So I was lucky enough to, and I say that because I come from a place where I was doing exactly the same thing.
Where?
In Idaho, the state of Idaho, yeah.
So you came from Idaho to Chicago?
From Idaho to Chicago via Roswell, New Mexico.
Wow.
Yeah, big detour.
Big triangle.
Big detour, yeah. I went to Roswell thinking that I was going to stay there, but I didn't like it.
Did you see any aliens?
Yeah, exactly.
All along Main Street, there's a lot of shops that have the aliens for sale. Yeah. No, I came here, and so 4 months into moving to Aurora, I saw the job announcement, I applied, and I never thought I was going to get it, but within a couple of weeks, they called me and said, do you want to come for an interview? So I did. And needless to say that I really enjoy working there with them. It gives me the opportunity to work with the same people that, you know, I like to work with, basically to provide them with services, knowledge, education on health, which is a very important topic for a lot of people, and being that they have a lot of illnesses and they don't have a place to go, but having community health partnership gives them a kind of a medical home where they can come and be treated for their needs. So you know, I like it being there. I hope, I don't know if I can last 8 years or 35 years like they do, but you know, I'll do my best to stay there as long as they keep me there. So
take it day by day, right?
Exactly, exactly.
So Susan, wow, you say you're not the oldest kid on the block, but tell us about the roots and why this organization was born.
Sure, I'm happy you asked that question because there is a long and deep and very interesting story. I'll try to make it as brief as possible. Many of the services that we now provide back in the 1950s and early 1960s were provided by church groups. There was a farm worker ministry that was active at that time, but working sort of below the radar, but they really are the foundation even nationally for the creation of the migrant health program. You probably are too young to remember this, Juan Carlos, and Joel and Monserrat might not have been in the U.S. at that point in their lives, but in 1962 there was a landmark documentary that really changed everything in terms of the consciousness of the plight of migrant farm workers in the United States. And that was Harvest of Shame. And I remember vividly being a child sitting on the ottoman in our living room watching this program because they showed it the night after Thanksgiving, which is when everybody's home watching TV, right, and digesting leftovers from the night before. But the impact was incredible because everyone assumed that the grapes of wrath was a thing of the past. At that point, most of the migrant farm workers were African American, but that led to the creation of the Migrant Health Act in 1962, which then led to the creation of programs like ours. So that's the backdrop to it. But in terms of our organization in particular, originally we were part of the Illinois Migrant Council, which is at that point was a larger social service organization that provided an array of support services to farm workers and their families, and we were the health program thereof. But in 1991, we became a health-focused only organization. We're funded primarily through the U.S. Department of Health and Human Services, and we are part of a family of community health centers that a lot of your viewers are probably familiar with if they know Centro de Salud Alivio, Centro de Salud Esperanza, Erie Family Health. We're all part of what's called federally qualified health centers. And we have the mission collectively of serving individuals and communities and improving the health status of communities through primary health care services that focus on primary prevention as well as dealing with more complex chronic conditions. So we've been around for now the better part of 4 decades providing comprehensive services to primarily migrant farm workers and seasonal farm workers and their families.
Wow, and there has been a shift as I've done some research on your organization on who you're serving, but we'll get to that in a bit. What are the primary areas where you work? Because your offices are located in the city, but your work is, I guess, outside of the city.
Exactly. That is
inside it, I guess, a little bit, and primarily outside.
Our services really are not provided in our administrative office. Historically, has always been in Chicago because, for various reasons. One, we are basically a statewide organization, so we relate, and we have over the years also had considerable funding from state sources, foundations, and that sort of thing. So there was good reason, and we have so many staff that have been with our program for so long. They some live out south, some live out northwest, some live in the city. So we've always had our administrative office in the Chicago area, but most importantly is where our services are. So our service areas are located in Aurora, Kankakee, Rantoul, which is down near Champaign. We also have clinics in Mendota and Harvard, so that's LaSalle and McHenry County. We also provide all the health and dental services for all the children enrolled in Migrant Head Start and Migrant Education programs, and those literally are from border to border throughout Illinois. So we even go down to the Carbondale area in the summer to provide services to migrant children in that area.
Wow, down, I guess, near Missouri, would that be?
Well, actually, that's more in the East St. Louis area. That's not quite where we go. There's another migrant health grantee there, but this is down near Carbondale, Cobden, Illinois. Actually, it's closer to the Kentucky border.
Kentucky, okay. I'm just trying to think of my trips through there because I'm like, who lives down here? Because it's so plain. But and Monserrat, what is your role in this huge area of work? What you mentioned something when you spoke about your work there about promotores de salud.
Yes, they are like health educators. So they go with the patients' houses.
Who are these health educators? You bring in people, professionals? Or?
I mean, we have, for example, a nurse from Mexico. So we have different kinds of people. Some of them are really farm workers, and others are the wives of farm workers. So we have different types of people. And before they start the program, they have some kind of training.
Okay.
And because when they go to the houses, besides that they talk about a health topic, they take the blood pressure of every member of the family. So their role is that they also go to there are different health fairs in the community or in the church, so they go to many different places to talk about health. And we also try to look for a new farm workers, because in Aurora we concentrate like in farm workers. Okay. So they always try to talk about health and prevent illnesses.
Okay, and you said that farm workers themselves do a lot of this work. I'm curious that I think that's rare for a lot of organizations to actually integrate people and empower them to also carry out the message and the work. How do you recruit people, and how do they respond when they go through the training and then they go out and serve their very community?
When we try to recruit people, it's funny because like the nurse, I met this lady in a health fair. So she was asking me about the clinic, and I noticed a lot of interest in her. So you can see when somebody has the passion to help somebody else, or I think Joel is going to talk about outreach. When we do outreach, we go to the farms. So when you go there, you also see like a leaders, or you see people like take the lead to, or many people who follow this person. So that's the point when I say, oh, this person might be a good promoter. Okay. So that's how you recruit. Or even in the clinic, like the staff tell me, this patient looks like it would be ideal for the promoters program. So there are different ways when you see, like, oh, these people have the passion to help somebody, or has the knowledge, or I think this is more about heart, more about care about help somebody else. So that's how we recruit people. Okay,
and these promotores, what is it when they're doing their work? What does it look like? Or tell me first about the training. How does that work? And then when you send them out.
Okay, so we meet once a week, and I invite people, doctors, nurses, people from hospitals, or even lawyers, or from different areas. So they come with us to the Aurora Clinic, and we also invite patients, depending on the topic. So they talk and they train us about different things. Or we also have grants. We just had one from the American Cancer Society. So they provide us a lot of material to prevent cancer, different types of cancers. So we have a training from them. Sometimes the training is like 1 week, or depending on the topic. So that's how we get these trainings from different organizations, hospitals, or wherever. So then after this training, we talk if they have any questions or whatever. And after that, they go to the community to talk about that and try to help and reach as much people as possible. For example, for the American Cancer Society, they educated more than 3,000 people.
Wow.
So, yes.
Wow. That's pretty amazing work. And while your area is mainly in outreach.
Correct.
And you go out to the farms and to the people themselves.
Yes, and let me just mention something related to farm working, because when we talk about farm workers, people automatically think that there's only people working strictly with tilling, planting, and harvesting the farms. But this agriculture segment also includes landscaping, people that does planting and transplanting of plant, trees, and sod. And so people that works in animal farms, horses, cows, chickens, turkeys, whatever. So all of these groups fall into the agricultural categories which we serve. And that's why around the Aurora area there's a lot of landscaping companies, and we go to them. However, sometimes it's a little difficult because when I call them or show up, to the office, and they say, I'm so and so with this agency, and I would like to talk to somebody that is in charge of the employees, and they automatically look at you and say, why do you want to talk to our employees? And
that's none of your business.
Exactly. And so I mean, sometimes it's tough, but I always try to make sure that I explain to them right away the reason of my visit and how it's going to benefit their employees, and so that way I can open some doors for later on for us to come back and do registration of patients. So when they come to our clinic, we have them already in the system, and they can. They don't have to wait a lot of time when they come to the clinic for a visit, because if we register them ahead of time, that helps a lot. Okay. But the outreach, of course, is sometimes you have to not only do it by yourself, but what I do associate with other non-for-profit agencies in the Aurora area, because we serve not only Kane County, but we also go to DuPage County. Even patients from Cook County come to our clinics. The Cobb, Kendall, and Will counties. So we serve everybody that comes from those counties into the Aurora clinic, because we are the closest to these counties. So we don't turn anybody away as long as they fall within the category of working under the agriculture, category. And again, we know that being a one-man band, it's hard to it's hard to do everything. So I've been working with a couple of agencies there really close in the Aurora area. One is Family Focus, which is also a non-for-profit working with families. Also, there's a group called Compañeros en Salud, or English is Partners in Health, and this is made of people from different agencies, two hospitals, the health department, Family Focus, and other agencies. So now we are part of them because we want to work to reach more people that way, because if they know who I am and what I do, chances are that they will tell their patients, oh, if you need health care and you don't have insurance and you don't have, or do you work in this type of business, then you can go there and be seen, and you don't have to worry about paying full price for the visit, because we use a sliding fee scale program, and they pay based on their income. So that's how we do it.
Sounds like great work you're doing. We're going to continue with your work and how it's going about, but I want to look at some of the images you provided, just to show our viewers your work out in the field. That some of them are pretty beautiful images. We're going to be looking at them, and we'll go through them slowly and talk about them, and so that we can have a view of what you're actually doing.
Would you like us to comment on this, or did you want to?
No, let's comment on it, please.
What I wanted to say just at the outset of this is we had the great fortune of being contacted by a young woman about a decade ago. Her name is Julie Wrighton. She was working on her MFA in photography at Illinois State University, which actually houses a photographic archive of farm life in Illinois over the last 2 centuries. And but there was not a single photograph of a farm worker in all of that archive. So her intention was to contribute that. So she did, I thought, an extraordinary job, and what I loved about her work is that it captured the dignity, the beauty, even within a context that sometimes may not look like the most favorable living and working circumstances, because they certainly aren't. But the first photograph that you saw was a family in the Mendota area, and literally you can see the roof coming in over their heads, but this family stands together with such great dignity. This is a farm worker woman in Kankakee, in Will County, actually. And I just love compositionally, I think they're artistically beautiful, but you can see the very humble circumstances. This was an entire family that was living in a shack. Essentially, they came every year to work for the same farmer. They're Texas-based farm workers. And
this image is, what are they harvesting, or are they harvesting in this?
I'm having a little trouble with the lights to see exactly which one that is. But yes, it is a harvest. I can't see from here exactly
Looks
what
like
the
strawberries or tomatoes.
I thought it was tomatoes.
Probably tomatoes.
Yeah. And as you can see, this starts to capture some of the challenges that farm workers have. The work that they do is something that we all tend to take for granted. We know where we buy our food, but we don't know where it comes from. There's a lot of, as Joel was mentioning, there's a lot of things we don't necessarily think of as agriculture, such as the flowers we buy at the farmer's market. This is a photograph of one of our families that we serve from the Kankakee Clinic at their home down in one of the colonias in South Texas.
In South Texas.
Exactly. Wow.
So this is, we're actually connected, I guess across continent.
Absolutely, absolutely, and intercontinentally as well. The work can be very backbreaking, and this is one of the workers at Kankakee Nursery, and you can see that the work is really, agriculture knows no boundaries in terms of 9 to 5. So typically workers are leaving very early in the morning and coming home very late at night.
And this image is...
this is us doing health outreach at one of the camps just outside of Aurora. In fact, that's Gloria Rivera, who's now our clinic director. She was one of our community health workers when this photograph was taken. So we literally go to the trailers, go to the migrant labor camps, go to people's homes, and they invite us in to not just register, but we also do health screening, and it's astounding to me every year how many young men and women we find who have already high blood pressure, signs of diabetes onset. So our goal is to find that and diagnose it as soon as possible.
And this is
these are images of our a medical and dental clinic in Aurora. Exactly. So you see our dental team there. We have a 3-chair dental operatory, and there's our clinic team. Joel, this was taken before Joel joined us, unfortunately. But that's in front of our clinic on South Lincoln in Aurora.
Okay. Well, it sounds like, well, I mean, and from what you've been telling me, you're widely dispersed and are doing a lot of difficult work in trying to, I think, make people conscious and aware of what they might be needing and what they're lacking, as far as, because you mentioned diabetes, right? That's a chronic disease, but a preventable chronic disease, right? And now a lot of people, if you have type 2 diabetes, you can actually get rid of it, right?
Well, that's
in many ways.
That's,
it can be managed.
You can't really get rid of it, but what it can be is controlled and managed well, so that your life is not, so that further complications that can result from diabetes don't develop. And certainly there's much that can be learned in terms of changing patterns of eating, patterns of activity and that sort of thing with the next generation. So the impact that working with individuals who are living with diabetes can have on their entire family and communities. A lot of our, over the years, like Margarita, one of our promotores from a while back, was herself diabetic, and she, you know, many diabetics go through a period of denial about their condition, but when they see the light, they can become the best promoters and health educators, and to help others to support them through their disease process.
And for people with, I guess, dental health issues, what's most common, and how do you help families and individuals become more aware of how to better care for their oral health? But what do you see, and how do you help them, you know, like become part of that more active in it?
Like for example, the promotores go to the houses and talk about how important it is to take care of the to go to the dentist at least 2 times a year. But something good that we have is that we have different brochures. But for the kids, we have like a coloring or games for dental. So we try to put like funny pictures or whatever, and they are kind of playing, but at the same time they are learning. Like, oh, I need to brush my teeth like every 3 times a day. So they are putting even like sticker every day, that every time that they do this. Oh, wow. So it's a funny, we try to do a funny games or things for them to learn, and at the same time to see that that is a game. And we also try to teach people and showing them like how important is to take care of your mouth, because I mean they can see a very bad pictures when if you don't take care at the beginning, the problem goes to the whole mouth, and then it's a problem that you could fix if you will started going since the beginning. So,
Right.
as Susan said before, we try to make conscience, like if you see that the parent has this problem, don't do that with your kids.
Right.
Or try to avoid drinking a lot of sugar in the juice or in the bottle for the babies. So we try to do this.
And oral health is connected to cardiac health.
Absolutely,
right?
yes. Absolutely.
And it's so vital to care for the entire body, really. And what kind of when you're doing your outreach work, what are the main health questions you're hearing from people?
You know, I've seen a lot of folks having high blood pressure, and working during the summer. They work out, of course, and if they have their blood pressure really high, that can be a problem. And so that is one of the main issues that I've talked to people about, and that's why, as you saw in one of the pictures, when we do outreach, we take our equipment and do high blood pressure checks. And if we notice something that is out of control, of course, we always recommend that they come to our clinic so they can have a check by the doctor, which is very important. But I mean, like you mentioned before, the chronic diseases like diabetes, high blood pressure, high cholesterol, and of course, as we know, the results of eating too many items from dollar menus at McDonald's or Burger King's. I mean, the obesity, which is also creating a lot of problems in our people. We try to educate them on how to be conscious of what they eat, how to control their diets, because if they don't do something to help themselves, I mean, they can come to us and we can do what we can, but other than that, they have to do their part. Right. So anyway, that's what I do, and this takes a lot of effort, a lot of stress sometimes. But if you do it thinking that you're going to help somebody, it just makes you feel better.
Okay, we're pretty close to the end of the show. We're almost out of time. I'm curious though, as to what your vision is going toward the future in a very brief phrase or one word for your organization. Start with Susan, please.
I would say comprehensive immigration reform.
Okay, wow.
One of my, one of the things I've learned over the years, and it's come into focus and mightily in recent years, that we'll never really have meaningful healthcare reform until we have comprehensive immigration reform, which disenfranchises so many of the people we're trying to reach. Okay,
one word?
By education, prevent illnesses.
Okay, and what? One word, we're out of time.
Preventive healthcare.
Okay, great. Thank you so much. There's so much we could talk about, but it was great to hear about what you do, and I wish you well in all your efforts.
Thank you so much.
Thank you.
Perspectivas Latinas is a community service of CAN TV. If your nonprofit would like to work with CAN TV, call 312-738-1400 and ask for nonprofit services. Tune into Perspectivas Latinas for local issues and concerns every Thursday at 8:30 p.m. on CAN TV 21. I'm Juan Carlos Hernandez. Thank you for joining us.